Hi, I'm Dr. Jess, and I'm here with Hannah. Dr. Hannah, she is here with Yinergy Acupuncturist, and she is incredible. So, Hannah, why don't you introduce yourself with who you are and how you got into acupuncture and why you specifically specialize in women's health?
Well, thank you, Jess. Yes, my name is Hannah. Jess and I went to school at the same time. I got into acupuncture. I actually was going to the U of M, the business school for undergrad, and I was going through a lot of my own like hormonal issues, menstrual cycle issues, just not feeling good. Like I was like, there has to be something else other than feeling subpar every single day. So I ended up finding acupuncture my sophomore year at the U. So I started going there, and it happened to be a women's health clinic. They had pictures of babies all over the walls. It was a fertility clinic. I just fell in love with it, and I started feeling so much better from the acupuncture. So once I graduated from the U, I went straight to Northwestern to learn acupuncture, and here I am today. And that's why I specialize in women's health.
Thank you, Dr. Hannah. I'm so excited to hear about your journey and everything that you've went through to become an acupuncturist. So, right, how do you, or what is acupuncture? Do you want to just explain a little bit about that?
Yeah, so acupuncture it falls under the umbrella of traditional Chinese medicine or East Asian medicine. And Chinese medicine is a complete medical system that's been around for thousands of years. And it's actually changed like very little since the like major medical texts came around, like in 600 BC. Modern acupuncturists are still learning um, those same principles in Chinese medicine. So it has not changed much since the beginning, which shows how it really has withstood the test of time. And as far as acupuncture goes, Chinese medicine believes that the body is made up of qi or energy. It very loosely translates to energy. And the energy in the body flows through what are called acupuncture meridians. And you can think of these meridians as like energy highways. And the 12 major meridians are connected to the 12 major organ systems in your body. So if there's any obstruction of flow along these meridians, it can wreak havoc on your body. It brings it out of balance, and then symptoms or disease arises. So, what acupuncture aims to do is acupuncture points that fall along these meridians. We really focus on restoring energy to the body again. So, that's the Chinese medicine explanation for why acupuncture works.
That's amazing. And I know, like, personally, mine is like, I absolutely love acupuncture. I am like a diehard acupuncturist through Dr. Hannah, of course. But yeah, she's helped me out with so many things. And specifically for me, she always says, like, my gallbladder line is like deficient. And so we work on that for many different things. And so, how do you exactly know, like, where to put these needles?
Yeah, so the needle placement is determined by the underlying issue that's going on with the patient. So that is determined by doing an intake. And as you know, Jess, there's a lot of questions that are involved, especially in the initial intake with Chinese medicine, because no two patients would have the same symptom for the exact same reason. Like several patients might walk in with a headache, or whether it's a hormonal issue, like struggling to conceive, but the underlying imbalance is very different. So the intakes will involve like many questions, again, as you know, and also looking at the tongue and feeling the pulse. And this allows us, and this is why Chinese medicine school takes a long time, because you have to learn a lot to be able to recognize these differences in the pattern diagnoses or the patterns of disharmony. And once we have that pattern diagnosis, then we can pick the points that will bring back balance to the organ systems into the body.
Amazing. So how does this kind of correlate with like modern medicine, Chinese medicine? Can you like flip-flop between the two, or how does it like connect with modern medicine as well?
Yeah, so they're definitely complementary, although they're kind of like speaking two different languages. But I think that we're really working on bridging that gap right now. And there are so many modern medicine practitioners. In fact, I was just at the American Academy of Medical Acupuncture Symposium a few weeks ago. And medical doctors are really trying to understand how acupuncture works from a modern medicine perspective, but you really can't take it out of the context of Chinese medicine and expect it to still work. So I think that we're finding this good bridge where we can use modern medicine and medication when it's needed, and then try to use acupuncture and herbal medicine in areas where it's appropriate as well.
Amazing. So it's like bridging the gap between the two, and like how can we like use modern medicine when necessary type of things, but how can we build that holistic body and homeostasis from internal beforehand, right?
Yes, absolutely. And unfortunately, in America, oftentimes by the time you see a patient, acupuncture was the very last thing that they've tried. But I think that that is really changing. And in the last few years, despite acupuncture being around for thousands of years, it was really just in the last few years that it's become widely accepted by modern medicine. And like medical doctors, chiropractors, like all these different practitioners are now referring patients directly to acupuncturists. And a lot of it has to do with now, Medicare covers it. Like it's better, it's more well studied. But as far as how it works from a modern medicine perspective, was that part of the question too?
Um, no.
Kind of.
Yeah, just general.
Okay. Yeah. So any other questions? I kind of went on a tangent there.
Oh, no, that's perfect. How does it work when it becomes to like women that are struggling with infertility or keeping fertility or throughout their pregnancy journey? So how does acupuncture kind of flow within that realm?
Yeah. So fertility is a very commonly treated and studied condition right now. And as a chiropractor, you're probably familiar with how important it is for just the nervous system to be in a state of balance and for the woman to not feel lots of increased stress and like being in fight or flight mode, because that just wreaks havoc on all of the systems in the body and especially the endocrine system. Um, so in Chinese medicine, we really think of it as, and even if you think of it from a more modern acupuncture perspective, I like to explain to patients how your body has two different states that it's in as far as the nervous system goes, and that is rest and digest or fight or flight. And when you're in fight or flight mode, your body is basically in avoid danger mode. So it's, instead of prioritizing the reproductive organs, the digestive organs, it's sending all of the blood flow, all of the resources to the organs that are necessary to run from a tiger that you're being chased by. And in modern life, of course, many of our modern stressors, we're not actually in danger, but the body has no way of deciphering, like, is this state of stress, am I in physical danger or am I not? So even modern stress really affects the body, and it reduces blood flow to the pelvis, to the uterus, to the ovaries. So part of acupuncture is that the needle is stimulating, around the uterus, the lower abdomen. There are points all over the body that are called distal points that still affect the flow of blood to the uterus. And this is where the meridian systems come back into play.
Right.
Is we don't actually have to needle near the ovaries to improve blood flow to them, although it works both ways. So that's part of it, is just improving like oxygenated blood flow and signaling to your brain like, okay, we can focus on this again. And the other part of it is just allowing your nervous system some time outside of that fight or flight mode, where the parasympathetic, kicks into gear, and your body can almost take a breath and say, okay, like, we're safe, and now we can prioritize fertility. Because when you're in a state of fight or flight, carrying a baby is not your body's number one priority.
Right.
Yes. And as far as pregnancy goes, acupuncture is very effective kind of for all of those same reasons, with carrying the baby to term as well. And especially in that first trimester. And if there's a history of like recurrent miscarriage, acupuncture is really good at keeping the body in a state of a calm womb and in that parasympathetic, like we're safe, we can support this pregnancy type mode.
Awesome. And do you also work with men with their fertility if they're also struggling with fertility too, to help their women out type of thing?
Yes, absolutely. And it's often because the woman made them come in at first.
That makes sense.
At least in my practice, and I know that's the case for a lot of different practices, is primarily it's women that are seeking it, but it should not be that way because men need care just as much, and their nervous systems are also under a lot of stress in our modern lives.
Mhm.
Um, and as far as Chinese medicine goes, there's a very long history of treating male fertility,
Okay.
treating impotence, treating like erectile dysfunction, all of that, and it's very effective at it as well. And modern studies show that acupuncture has an effect on sperm quality, sperm quantity, motility. So it is definitely a good option for men as well.
Definitely. So when you're starting to conceive or trying to conceive, both parties should probably get seen by someone just to kind of support the pregnancy, support the whole body, essentially, right?
Absolutely. And when it comes to trying to conceive, and I don't want to get too into the weeds here, but like, and I'm sure other healthcare practitioners are very much aware of this, but oftentimes the average patient is not. Folliculogenesis takes 90 days or 3 months. So the follicle that you end up releasing, which is what becomes the egg or the embryo, is actually predetermined by the body 3 months prior. So as you mentioned, like when a couple is starting to think, okay, like we want to conceive soon, it's a good time to start acupuncture prior to being like, okay, I wanted to be pregnant yesterday.
Right. That makes sense. And when a woman comes to you and has like breech babies, you do Moxibustion. Could you tell a little bit about Moxibustion and like that journey to help that baby go head down?
Yes. So moxibustion is used all the time in China. It's very frequently mentioned in all of the classical Chinese texts going thousands of years back. And the idea of moxibustion is that it's much more nourishing than acupuncture is. So with acupuncture, as I mentioned, those meridians, when there's stagnation in the meridians, acupuncture is very good at removing that stagnation and then restoring flow in the body. But when there's a lot of deficiency, moxibustion is the herb mugwort, and it's burnt and it's held over the point. So it's not burning your body, it's not painful, but it's warming of the point. And that is seen as more nourishing. So moxibustion is used all the time, but specifically for breech babies. Um, Again, it's been used for thousands of years to help turn babies and get them into the right position. Um, and in that case, the point bladder 67, which is at the end of your little pinky toe, it is very influential because the bladder meridian is the last meridian that is developed in utero. So warming the end of this channel encourages the baby to go head down towards that channel. And it's very gentle, so it's not going to stimulate labor prematurely. But from a modern medicine perspective, what it's doing is it's releasing like endorphins. It's actually increasing estrogen, prostaglandins, and it's creating a little bit more room in the uterus for baby to turn head down. But again, Chinese medicine wise, it's very energetic and it pulls the head downward.
Oh, that's amazing. So it's like analogy, it's kind of like grandma's baking cookies in the kitchen. You're automatically drawn to that space
Yeah,
and you want to go to
I love that.
it.
But I might steal it from you.
Oh, absolutely. That's what I was just thinking. I'm like, yeah, I love it. It's just drawn to that energy, right?
Yeah, and it's really
Yeah,
cool to see because when I'm in the clinic and there's a pregnant mom on the table, the baby often, you can see the movement increase a lot.
that's
Um,
amazing.
I always say babies love acupuncture. When the needles go in, the baby starts to move a lot, react a lot. And then when the moxibustion starts, often even more so. And then
Mhm.
moxibustion is something that you can do at home as well. So I will send patients home with a few moxibustion sticks and they can do it at home. And typically it's like a 10-day protocol
Mhm.
or once baby flips, but whichever happens second. So
Okay.
even if it flips, you want to keep doing it to ensure that he or she stays head down.
Oh, that's amazing. And so I just want to like throw this out there for people who do not know. With acupuncture and pregnancy, you're not needling the womb or anything like that. You're staying away from needles directly on belly, correct?
Absolutely. So in we do not touch the abdomen at all in the third trimester. And first trimester, we do not touch the lower abdomen at all. So we are getting nowhere near the womb when it comes to needling. And there are actually several points that we avoid because of their down bearing effect until later stage pregnancy, until they're 37 weeks
And that's
pregnant.
like more like induction type of things later on, right? Or is
Yeah.
that just, like totally off?
No, yeah, that's true. So a lot of the points that we avoid during pregnancy are points that we do to prep for labor. And I always hesitate to say labor induction because
Hmm.
acupuncture is gentle enough that it's not going to magically make something happen in the body that it
Hmm.
wasn't already prepared for.
Right. And that's what with chiropractic too, like when we're doing our labor and delivery appointment, it's
Mhm.
not, we're never going to put you into labor, right? We're just prepping the body so that you know what to do with labor type of thing. But that's from the chiropractic standpoint. But yeah,
Yeah,
really
and I
cool.
think there's so many overlaps with chiropractic and acupuncture when it comes to just putting the body in the best state that it can to heal itself. And I think that's like the beautiful thing about what we do.
It's
Um,
like they work well, so well together.
yes, they do. So I love sending my patients to Jess, and they love going. So yeah, it's been a good relationship to have.
It has been. All right. Well, thank you, Hannah. So I hope you guys have a wonderful day and enjoy listening about acupuncture.
Yeah, thank you so much for listening and thank you for having me, Jess. I really appreciate it.